Hello and good evening, I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Health experts and activists have repeatedly sounded the alarm on the dire need for more healthcare facilities in East Malaysia. So Sabah and Sarawak, which collectively cover a bigger geographical area than the peninsula, still suffer from a smaller distribution of doctors and specialists, a lack of medical centres and amenities that in turn raise the cost of accessing healthcare, and poor supporting infrastructure like roads and clean water and electricity, all of which affect one's overall health and quality of life. So tonight on the show, we're going to be focusing specifically on Sarawak's healthcare system and its ability to manage non-COVID-19 cases during this pandemic. Joining us on the line now, we have Agnes Padan. She is the Women Chief for PKR Sarawak. She's been campaigning for better healthcare for Sarawakians for more than a decade now, particularly through the Kam Agong campaign, which aims to raise awareness about the state of healthcare in Sarawak. Agnes, good evening. Thank you so much for joining us on the show tonight. Now, I'd like to begin with your brother Sam, who is in Miri now and is suspected of having TB, of having tuberculosis. Can you share a little bit about Sam's story and why it exemplifies why Sarawak is in dire need for better healthcare services?
Hey, Melisa. Sorry, I'll just say what I hear from you, okay?
Yes.
So regarding my brother, we actually sent him to the Miri Hospital on the 18th of January. So which he was already started vomiting blood that time. And it's quite, to me, it's quite a lot, and it's really sounds scary to me lah. So then we took him to Miri Hospital by my brother. So when he reaches the hospital, then the doctor got to have a look at him, and then they did an X-ray on him, and then after that, later he was told the X-ray is not clear enough for them to diagnose. So he was then after that asked to go to a nearby clinic Kesihatan, and then after that, later he went there. So they did another X-ray and was not have the result yet. And he was asked to come for 3 days for saliva test, so which he did, and we are now still waiting for his results on the 28th, supposed to be on the 28th. So now the reason why the doctor called me a few days ago, the doctor was trying to explain to me why they couldn't admit him at the moment, despite his condition quite serious, because they are now facing COVID cases, which now involving 20 of the hospital staff themselves. So which now the hospital Miri is on full COVID watch. So they don't want to take the risk, I suppose. So now we have sent my brother to another hospital, MCMC, because they have no other choice, and we wanted to cut costs, compared to general hospital or private hospital. You know the differences of the charges. So which actually hospital Medicaid could have done the same actually, but then at this moment they couldn't accept him because of the COVID cases is quite very serious in the general hospital.
Right. Agnes, can I interrupt and ask you, Agnes, while you haven't had a diagnosis for tuberculosis, or positive one at least at this point in time, is tuberculosis something, or TB as we often call it, is it something that is present in Lawas? I understand your brother's very young, he's 30 years old. Is it common to have TB in that part of Sarawak?
TB cases, this is the first time I heard, since it happened to my brother, even though he was not diagnosed yet. But what we know based on the data we have from 2018, actually, there's a higher prevalence per population in Sabah and Sarawak. So altogether, there are about 35,000 cases of TB a year in Malaysia. But it seems higher in Sabah and Sarawak.
Right. I know that you've been campaigning a lot about, the lack of access to healthcare, particularly in Lawas, where you're from. Logistics were already challenging even before the pandemic hit and all the subsequent lockdowns. But is Sam's case, in terms of not being able to be admitted into hospitals because they are dealing with the COVID-19 pandemic, is that one? Do you see more examples of such scenarios where non-COVID patients are struggling to get treatment because hospitals are so full dealing with COVID?
Yeah, I think the problem now, the issue is location, because what I know is I'm now based in Lawas and I was born here in Lawas. So I can see the difficulties all of the patients are facing now, especially when this COVID is going on. So I have met this few other patients. I have met this patient, a cancer patient, and she's at the age of 47, and she has this cancer at the late stage. And all this while, she was going to hospital Likas for her treatment for a few years now. But then when pandemic happened, this last year, the whole year, she has to postpone her treatment and follow up for four times in a year. And this kind of things. And I have to arrange end of last year, I think, if I'm not mistaken, 1 week, I have to deal with documents. I have to go to the police station. I have to go to this Majlis Daerah to get a document for her in order for her to go through border Sabah for her follow-up. So this kind of things, not only the journey, not only the distance, but also is the cost of traveling, is crazy. So what I did, I drove her from Lawas. I sent her to the Sabah border, which we call Sindumin border. So I have to engage another transport, which I have to pay the transport to Hospital Likas, 200 ringgit I paid for her. They are the patient and they have to bear all of these costs, and they are very, very sick. And it's not easy for them. Not only that, they have to go through this swab test and they have to wait like 45 minutes as a patient sitting there waiting,
Agnes, I understand, and I appreciate the difficulties that a lot of people are going through at the moment. I just want to ask it very quickly. The last question: is basic healthcare services still working though? I mean, kids born, are they getting vaccinated? Is maternal healthcare still operating at this point in time?
Can you repeat that again?
Is basic healthcare still operating though? I mean, like vaccinations and maternal health, is that all still going, or is that also being disrupted at this point in time?
Yeah, it's all involving all of the basic healthcare. Like in Lawas, even we have anybody was, any patient nowadays in Lawas, they can't travel. That's all I can say. Even for mom want to give birth, they're going to go. They can't go anywhere. Even, Brunei border is closed now. It's very difficult to go through. And what more about this patient, cancer patient at a late stage?
Yeah. Well, Agnes, thank you so much for joining us on the show tonight and giving us some insights and some perspectives as to what's really happening on the ground. We really do appreciate your time. We're going to take a quick break on Consider This, but in just a few minutes, we'll speak to an MP in Sarawak about equitable healthcare in the territory. Stay tuned.
AWANI Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 7.45 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro AWANI.
Welcome back to Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Let's continue our conversation about Sarawak's healthcare system and its ability to manage non-COVID-19 illnesses during this pandemic. Joining the conversation now, we have Dr. Michael Teo. He's Member of Parliament for Miri. Michael, thank you so much for joining us on the show. Now, we just spoke to Agnes Padan just before the break, and she raised the case of Sam, her brother, who's not able to get admitted into hospital despite a suspected case, a suspected diagnosis of tuberculosis. Now, I'm wondering, what does that tell you about the health system in Sarawak at this time and the treatment of non-COVID-19 cases?
Yeah, presently we are in having a big problem with huge number of cases of COVID admitted to all the big hospitals in Sarawak. So about 2 weeks ago, the number of COVID cases increased dramatically. So there are more than 200 cases in the Miri Hospital, which is 300 bedded. So you can imagine most of the cases are filled up with COVID patients in Miri Hospital. Kuching Hospital, it's 1,000 bedded. Again, almost 200 people admitted. And the worst thing now is the number of staff in Kuching and in Miri are affected and quarantined, about 20 of them in Miri. So now the service has to suffer because staff and the other contacts are quarantined. So that's why the service cannot continue as before. And I wish the public to be more patient in case they are having minor cases not to visit the hospital. That is the advice from the hospital directors. If they are having minor cases, not to go to the hospital. So to go and seek treatment, luckily, from private hospitals or from private clinics. So there is a situation.
Michael, could you give us a sense of the difference between urban Sarawak and rural Sarawak in terms of options that the public has? Public hospitals, private hospitals, clinics, versus that are in the cities versus what is available in rural Sarawak?
Rural Sarawak, people are living very sparsely populated and living far away from the hospital. And now with the MCO, they find that they cannot go to the major hospitals. The flights are cancelled. The roads are blocked. So it's a bad situation now if you are sick in the rural areas. In the towns, it is not too bad because you have the major hospital there, you have private hospitals there, you have the private clinics there. So I think this is a very serious situation for people to be sick now in the rural areas.
Right, particularly if it's, diseases that illnesses that they're struggling with or have been struggling with to manage for some time, even before the pandemic. What options do they have, Michael? And already we know that Sarawak specifically has a lack of specialists. I believe that Code Blue, the health news portal, reported that Peninsular Malaysia has about 18 times more specialists compared to Sarawak across all major disciplines. What is this situation? What options do Sarawakians living in rural areas have if they need to deal with non-COVID-19 illnesses during this time?
It is quite a bad situation now. Before, we actually realized the lack of hospital beds even in the main areas in Sarawak. So in the whole Sarawak, we only have one major hospital in Kuching. That is the 1,000-bedded hospital in Kuching. That serves practically the whole Sarawak. So that is not enough. And we have been trying to build, for the last 7 years, another 300-bedded hospital in Kuching at the Petrajaya there. And that one, unfortunately, until now, is only 30% completed. So basically, that project did not help in this situation, COVID situation now. We already had plans to build Miri Hospital and Lawas Hospital, 300-bedded in Miri and maybe 100-bedded in Lawas. But that plan is always been brought up during the elections for the last 10 years, and then after elections, there was no commitment to build it. The good news is recently they said they will build Lawas Hospital and Miri Hospital. So that is a good news for the people in Miri, because particularly Miri, the beds are all full. Sometimes even the male is in the female ward. You can imagine that. And whenever I go there, it's such a bad situation because it is full. So that situation has been there for
Michael,
years.
can I ask you, sorry to interrupt you, but Michael, could you explain to us why there's a lack of political will to get these things done? Is the problem at the federal level? Is the problem at the state level? Is it a question of funding and resources? Is it a question of staffing? What's going on?
I think it is a political will from the federal side. Whenever they come for the election, they will promise to build a hospital, which they know that everybody is asking about it. But after the election, when they win the election, they somehow forget about it. And now I realize that a lot of money allocated for building hospitals is diverted for other projects in West Malaysia. So that is a sad situation.
Right. So the hospitals that have been promised to be built are not going to be built overnight. They're going to take some time to be completed. Michael, what would you like to see done to improve the situation for the short term?
Yeah, I'm living in Miri and I can see the urgency of the situation. The situation is getting worse now that the COVID patients are filling up all the hospitals and the whole state is in lockdown. So I really feeling quite desperate. The only thing we can do is for those people in the towns, please try to understand that the staff are working full time, and I want to take this opportunity to thank all the staff in the hospital who has been spending all the time looking after COVID patients, and some of them got infected as well. But the main thing is I want to highlight that we have a very stressful situation now in Sarawak, and rural people are suffering quite a lot. And I hope that more attention, more serious attention, and more funding should be diverted to building the hospitals that are promised, Lawas and Miri, and also to complete the Pan-Borneo Highway as soon as possible. And gradually that will help to improve the service for particularly rural people.
Right.
Michael, very quickly,
so
could you tell us, sorry, just one quick question, Michael. If staff in hospitals are getting infected, is it because they don't have enough protective gear? Is there lack of PPE in Sarawak hospitals?
I think there was initially a lack of PPE, and then a lot of NGOs and the government were supplying the PPE to these people. But again, I can see that it happens even in Kuching and other centers. So I think PPE might not be the only factor that is causing it. there probably is too many people coming into the hospital, particularly at the A&E, at the accident emergency, and that's where the doctors, quite a lot of them got infected because they didn't realize that these people coming in are actually positive, and they are actually not probably gowned with PPE. So there are a lot of factors involved, but fortunately, a number of them are recovering. None of them too serious. So the only hope now is we try to roll out the vaccine as soon as possible.
All right. All right, Michael, thank you so much for being on the show tonight. That was a very grim picture that you painted, but one that we needed to be told. Thank you for your time. We appreciate it. We're going to take a quick break on Consider This, but we'll be back with more, so stay tuned.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 7.45 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro AWANI sekarang.
Gagalan Kerajaan Persekutuan
Welcome back to Consider This with me, Melisa Idris and Sharaad Kuttan. Joining us on the line now, we have Dr. Helmy Haja Mydin, and he joins us to continue a discussion about an infectious disease that's not COVID-19, but tuberculosis, as we spoke earlier in the show, a suspected case perhaps in Sarawak, but one that may not be getting as much attention given all the resources focused on battling this pandemic. Dr. Helmy is a consultant respiratory physician at Pantai Hospital in KL. Helmy, every Malaysian, as I understand it, gets a BCG jab, a Bacillus calmette-guerin vaccine that helps fight tuberculosis. So why is it that we're seeing perhaps an emergence of this disease once more?
The BCG vaccine builds up immunity within your system, within our system, but it only works for approximately 15 years or so. And it's effective against the most severe strains of TB. So you're not talking about lifelong immunity, you're not talking about a vaccine that can be given repeatedly. So each vaccine that we give people for different types of diseases, they work in different ways. So when it comes to the BCG, it's not something that, once you give, you get lifelong immunity, unlike, say, the MMR vaccine.
Helmy, we were speaking to an activist in Sarawak earlier in the show, and she said that tuberculosis cases are disproportionately present in the territories of Sabah and Sarawak. And I wonder if you can give us a sense of why you would have this very different portrait of the disease, based on where you are in the country, assuming that all children are in fact vaccinated.
So your degree of immunity given by the vaccine wears off as you grow into adulthood. A lot of people believe or feel that TB is a disease of the past. They forget, or perhaps they are not aware, that in Malaysia alone, we're talking about 20 to 25,000 cases per year. And every year we see between 1,500 to 2,000 deaths. So it is something that's very serious, something that is still very prevalent in the country. Now, TB is also something that fortunately has a cure. Unlike many diseases that we deal with, there are specific medication that can be given to get rid of the germ. But it's a question of identifying or diagnosis the disease early. It's about getting to the right place to get the right treatment. And unfortunately for TB, it's something that needs a fair amount of time for you to take your treatment. So we're talking about a duration of 6 to 9 months. So once again, it's right person, right treatment, and right duration as well. Otherwise, you'd find the emergence of TB that's drug resistant, or you'd find TB that is easily spread from one person to another. We are all very much more aware these days about the ability of disease to spread as a result of droplets. So we're using our mask, we are practicing physical distancing, washing our hands. All these are useful not just for the SARS-CoV-2 virus, but also for diseases or bacteria like TB.
What has been the public health policy on tuberculosis in Malaysia? I mean, I know this is an old disease. We've been dealing with it for a long time. But what has it been beyond the BCG vaccination?
A lot of it involves things that, once again, we are getting more familiar with regards to COVID. So we're talking about contact tracing, early detection, getting in quickly to places where there's an outbreak. So, for example, we have seen a lot of clusters in prisons when it comes to COVID. Similar cases, similar studies have been done by the likes of Prof. Adiba, looking at the increased levels of TB within prisons. And once again, it is very environmental in nature. You identify areas where it's easier for things to spread. Very enclosed areas with poor ventilation, patients, or in this case, prisoners, not being able to get the right treatment or right screening and diagnosis for that particular disease, all of which actually increase the likelihood of getting the disease. So public health interventions are not just about vaccination. It always has to include other SOPs or procedures that, once again, we're more familiar with these days. And to kind of go back to what Sharaad was asking earlier, these things are very different depending on the part of the country that you're at. Resources, as we know, are not always uniform. It's very heterogeneous when it comes to what's available on the ground.
Helmy, where do you think there is a failure, institutional failures, when it comes to things like TB? We've been hearing from Suhakam, I think it did a study on TB in the prisons. Did we act on it? Who's responsible to act on it? And what's going wrong? Why is it that we seem to be able to identify the problem, but then not somehow? Helmy,
sorry, Sharaad. Okay, I can hear you now. Yeah, I think you're asking me about
why do we fail? Is there institutional failure in the management of diseases like a TB?
I wouldn't call it a failure in the sense that these are problems faced not just by Malaysia, but it's basically across the globe. And if anything, we are doing a pretty decent job in ensuring that TB medications, for example, is free of charge. And recently, there has been a bit more impetus with regards to prison reform. And this is led not just by NGOs like Suhakam, but also academics and the prison officials themselves. So at least more laterally, there is a recognition of how things have, or rather things need to change in places like the prison. That does not take away the fact that, I think perhaps you would have mentioned this earlier, there is a need for a more homogeneous level of investment when it comes to healthcare facilities. And this is not just about the physical infrastructure, i.e. hospitals, but also the appropriate doctors, the appropriate diagnostics, and the appropriate ability to actually take a patient from diagnosis all the way up to cure.
Do you think that perhaps, Helmy, our attention to TB has been put on the back burner a little bit, precisely because the pandemic is occupying front of mind? It's requiring almost all of our attention and resources at this time. Has there been a bit of a sidelining of TB at the moment?
I wouldn't say it's just TB. I would say it's most other diseases that we face. Your cancers, your ischemic heart diseases, your diabetes, everything is put on the back burner as a result of our focus on the pandemic. in some ways, it's actually beneficial for TB because you're halting the spread of TB by using your mask. You're actually a little bit more aware of the symptoms associated with TB, because if you're coughing, if let's say you're coughing up phlegm, you've got some degree of difficulty, or if you've got a fever, all of which are also hallmarks of TB, then you're more likely to actually get diagnosed. So in some ways, there is actually going to be an improvement in a respiratory infection like TB, but there are many, many other NCDs or non-communicable diseases that also bear or rather need attention.
Right. Well, Helmy, thank you for shedding some light on this disease, joining us on the show tonight. We really do appreciate your time. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.